Okay, well, we have some post-op patients we're going to interview if they are willing, or they can just say, hey. But one of the questions we get a lot of is, what about dairy products and lactose after the surgery? Well, it turns out that there's something called lactose intolerance, and lots of people who haven't had the surgery are lactose intolerant. Now, what happens if you're lactose intolerant is if you eat the milk sugar, lactose, which is a combination of glucose and galactose linked together, and you can't digest it, the lactose sugar stays in the gut and is undigested. And as it gets to the lower gut, the bacteria that lives inside you says, hey, she didn't want it, I'll eat it. So the bacteria eats your lactose, and everybody's good, everything's happy so far, except that the bacteria that lives inside your gut is anaerobic, without oxygen. And when it metabolizes the lactose, the waste product is not CO2, which is a kind of a benign gas, but instead it's two kinds of noxious, smelly gases called hydrogen sulfide and methane gas. That's the rotten egg smell. Not only that, the gas, when it's released, blows up inside of you and can cause diarrhea and severe abdominal pain. So lactose intolerance can be devastating if you don't know it and you keep eating dairy products. The lactose sugar can cause stomach dilation, swelling, pain, diarrhea, bad gas, and we've had people call absolutely crying. They've been told by their local doctor they have to have emergency surgery to undo the gastric bypass, and all it is misunderstanding lactose intolerance. Now, the enzyme that digests lactose is in the upper small bowel, which we bypass. Now, you don't have to have a bypass to be missing it. Some different kinds of ethnic groups will have a high incidence of lactose intolerance. So Northern Europeans, Mediterranean Europeans, African Americans, all can have lactose intolerance. But the gastric bypass, and the more you bypass, the more problem it is, can interfere with lactase and lactose digestion. Now, interestingly, even if you're lactose intolerant, yogurt, even though it contains lactose, is often something that lactose intolerant patients can eat. But that's the real sour yogurt, not a lot of these other fake yogurts like, you know the company TCBY? Do you know what that stands for? It means this is not really yogurt. Okay, so there's lots of, yogurt came to America and it was sour. And so people said, don't worry, Mr. Yogurt, I'll fix you up. So they made Go-Gurt and this kind of stuff and Yoplait and stuff that's not at all sour. It tastes like, candy. That stuff may have a lot of lactose added. So plain old sour yogurt, when you take a bite of it, tastes like sour milk. That usually is very well tolerated by my patients and by patients who have lactose intolerance. If you want to have a dairy product that may have some lactose in it, then we recommend that you bring to the table your own lactase enzyme, which you can buy in the grocery store, and it's called Lactaid. So if you have gas or problems and things like that, you can usually solve it by taking some Lactaid. So some of my patients, for example, have trouble eating ice cream and they'd like a little bite of ice cream. Well, you can do that. You need some Lactaid with it. Or you can get soy ice creams or things like that. The other thing is, if you want milk on your cereal in the morning, which you know has lactose, you can get lactose-free milk, and that seems to help. Does that?
So it needs to be just a plain yogurt, not strawberry or vanilla?
Well, a lot of the yogurts have been modified so that they're tasty to American tastes. Take a bite of the yogurt. If it tastes like candy, it's probably not your best choice. If it tastes like sour milk, you probably got yogurt. And you want the good bacteria in there, that lactobacillus, that seems to help with lactose intolerance patients. That's a good question.